Hi, I'm Dr. Feinstein. We're here in Chicago, and we're going to be talking about a new advance in treating urinary incontinence, a new surgical procedure called the neomedic adjustable TVT sling. That sounds pretty complicated. It's actually pretty simple, and it's very interesting. It's a concept that has been going on in Europe, and specifically in Barcelona, for the last 10 years. So this is a surgery which has been well accepted in Spain and the entire European common market, being done all throughout Europe, and has been for the last 10 years, but only recently has it come to America. Originally, it was done at the Cleveland Clinic in Florida, and as far as I know, I'm the first and still the only one to be doing it in the Midwest. We've done our first few cases, all successful. We've done half of them in the office. We've done half of them at the hospital. The new procedure is a very simple procedure, a very interesting reason why it's needed. The typical surgery for urinary incontinence in women is called the TOT procedure, and that is a sling, which is a piece of mesh or artificial material, which goes underneath the bladder through the vagina, and it comes out along the sides of the bladder, and the O in the TOT stands for the obturator canal. So it goes underneath the urethra and comes out along the sides of the urethra, so the tape is pretty much going flat. And it's giving the urethra support, so the muscles that are weak have now been replaced by this TOT sling, and the sling is giving the support that the urethra needs, and in 90% of the cases, it's successful. 90% is a good number. Unfortunately, it's not 100%, which is the number we'd like to see. Now, when you're dealing with hundreds of thousands of slings that are done every single year for hundreds of thousands of women who are incontinent, if there's a 10% failure rate, that's a large number. For every 200,000 women who have that surgery, there are 20,000 women, or 1 in 10, where it may not work. The reasons why it may not work are very different reasons, depending on the anatomy, depending on the particular lady, depending on if the doctor had the right diagnosis to begin with, depends on if there's a combination of more than one problem going on at the same time. For example, the lady may have stress incontinence and at the same time have a severe overactive bladder. She may be cured of her stress incontinence, but still have the severe overactive bladder, so she still is going to look like she's incontinent, even though the stress component has been fixed. So for 10% of these ladies who have the surgery, the TOT standard mesh, standard sling procedure, 10% of them may not be corrected. The usual reason that it's not corrected is that the pressure and the tension on the sling was not tight enough against the urethra to obstruct the urethra and give the relief from the incontinence. So if it's not tight enough, then the answer would be do the surgery over and make it tighter. Fine. The question is, how do you know how tight to make it? And if you're going to do it a second time, what are you going to do differently that you didn't do the first time? That's where we have this new advance, the adjustable sling. This is the first and the only sling where you put in the sling, you leave it very loose. It is not correcting the problem. You send the patient home an hour after the surgery, and then the patient comes back 1 or 2 days later, back to the office. You adjust the sling, you make it tighter until you could see right there in the office that the incontinence has been corrected and that the lady no longer has incontinence. Let me show you how it works. This is a model, but it's also the actual sling, and it comes in various components. There are 3 components here that you can see. The first component is this sling itself, which is the same, uses the same material as all of the slings that we normally do for correcting urinary incontinence. This is a sling that we also call a mesh. Some people call it tape because it looks like Scotch tape. But this sling goes underneath the urethra. The urethra is the opening of the bladder. The sling goes underneath the urethra, and it's put there through a small incision inside the vagina. This sling is attached to sutures on the right and the left side. These sutures carry the sling up to this tension adjuster, which is at the top right here. This is the part that's new, and this is the part that's different, and this is the reason that it's successful. With this tension adjuster, we actually send the patient home an hour after surgery with this tension adjuster inside the patient, but with this screwdriver that I'm holding right here, outside the patient. In other words, this is outside her belly, and it looks like this when she goes home. This is the way it would look with the screwdriver coming out of her belly. It will stay that way for 2 days. We send the lady home with the tension adjuster inside of her under the skin, but attached to the tension adjuster is the screwdriver. So the patient goes home with bandages, covering up the screwdriver, but on the second day, when the patient's lying on the table, we take off the bandages and the patient has this screwdriver coming out of her abdomen. What we do is we turn the screwdriver, a series of turns, we fill up the bladder with water, we ask the lady to cough, she still leaks. We knew that she would. Then we turn the screwdriver 5 or 10 turns, and each time we turn the screwdriver, it lifts the tension on the tape by 1 millimeter. We can turn it 5, 10, 20 times, as many times as we have to. We turn it 5 or 10 turns. That makes the sling tighter. Then again, we fill up the bladder with water. We ask the lady to cough. She probably will continue to leak, and we say, perfect. And then we turn the screwdriver another 5 or 10 times, making it tighter still. Then we fill up the bladder again with water, ask the lady to cough, and we continue on that process until we have adjusted the tension of this sling so that the lady stops leaking completely and there is no further leakage. When we reach that point, we know that she will be dry. We know that the lady will be able to urinate without any problem. We know the lady will be able to cough, sneeze, do all those activities that she couldn't do, and we know that there will be no more leakage. And at that point, we simply take out the screwdriver from her belly. We put another locking screwdriver inside here. We turn it a quarter of a turn. It takes the screwdriver out, and all that's left is this tension adjusting device, which is under the skin. It's not showing. There's nothing showing. It's completely invisible. The lady doesn't know she has it because she can't see it. It's under the skin. The screwdriver is removed usually on the second day after surgery, and the lady has the tension adjusted perfectly, which is the difference between the primary operation that she had, which unfortunately did not work, and this new surgery, which works perfectly because we don't adjust the tension till after the lady has started healing, and by 2 days after the surgery, she's feeling fine already. We bring her to the office, we adjust the tension, make it the perfect tension that it needs to be, knowing 100% that we've got it exactly right. Then we take out the screwdriver, problems are solved. So with this new device called the Neomedica device, the Neomedica adjustable sling from Barcelona, Spain, we are now having something that's exceptional, something extraordinary that we can offer to women who unfortunately have had a previous surgery that did not work. And as we know, 10% of the slings will not work for one reason or another, the most common reason being that the tension was not adequate to stop the incontinence. Now, for the first time, we have a way of exactly measuring, adjusting, and fixing the problem with the tension, that it becomes perfect. It becomes the appropriate tension that each individual patient needs, and at the end of the day, the incontinence is cured. We'd be very happy to answer any questions that you may have on this particular option and to discuss whether this may be the right option for you in your circumstance, and we'd be very happy to hear from you if you'd like. Thank you.